I'm Dr. John Stone. I'm a professor of medicine at Harvard Medical School and a rheumatologist at the Massachusetts General Hospital in Boston. You've started steroids and begun to educate yourself about steroids. Perhaps your doctor referred you to Sam, or perhaps you found Sam yourself through your patient advocacy group or just exploring online. You can now begin to have a conversation with your doctor about steroids. It shouldn't be confrontational. Your doctor and you want the same things: to control your inflammatory disease and to try to prevent the side effects of steroids. I think there are three basic questions when having a conversation with your doctor about steroids. The first is, how long do you think I will need to be steroids? It's really important to have a sense of the timeline. And for many inflammatory diseases, the timeline is months rather than just days or weeks. So if the answer is more than a couple of months of steroids, then you should ask, should we be thinking about a steroid-sparing medication now? It's really important to think about a steroid-sparing medication or a strategy for lowering the prednisone dose and ultimately stopping it altogether. Important to think about that early on. When that first prednisone prescription is written, there really needs to be a plan formulated to get the patient off steroid using another medication if required. And the third question is, what should I be doing to protect myself against potential side effects of steroids? The weight gain, the osteoporosis, the risk of infection, diabetes, and other things. So when you go to your doctor, it's useful to have a short list of things that you would like to address. And steroids really need to be either number one or number two on that list. Controlling the underlying inflammatory process is generally number one. But if that is well controlled, then getting off steroids needs to be number one while keeping the inflammation controlled. The things that are useful for your doctor to know about are the ways that steroids might be impacting you specifically. You've begun to learn about the impact of steroids on your body and on your mind and on your emotions. So if you are having profound difficulty sleeping, if you are short-tempered and tend to fly off the handle, if you are not having success in controlling your appetite, if you're not pleased with weight that you are gaining, then all of those things are important to bring up to your doctor. Patients generally like to please their doctors, I've found. So when the doctor asks, "How are you doing?" the patient says, "I'm doing great. I'm doing well." And maybe in the context of controlling the inflammatory disease, they are doing well. They are certainly better than they were before they received the correct diagnosis and started therapy. But the therapy may be associated with a whole host of other things that are very problematic for patients. So when the doctor asks how you're doing, be prepared to really say how you're doing and the things that are impacting you. Some of those may be related to the underlying disease, but many of them may be related to the treatment. And it's important for your doctor to know about both of those. Often patients are not sure what symptoms are due to the underlying disease and what are due to the treatment of steroids. And it's important to talk about this so that there's clarity with the doctor.